tell us who you are and what your job title is?
I'm Elizabeth McBurney, and I'm in private practice in Slidell, Louisiana, which is a suburb of New Orleans. And I'm on the clinical teaching faculty as a full professor at LSU Medical School and Tulane Medical School.
Okay, that's enough medical schools to
That's
keep you busy, I'm sure. So you've heard the spiel, but I want to give it to you anyway a few times. But, we're really thinking in bullet points here.
Okay.
Concise answers. If you have an anecdote that you want to share, please feel free, as long as you keep it to the point that we're trying to get at. And really, this is just for the benefit of you. We're trying to encourage people to give to the foundation and for students to understand how important it is to be a member.
Right.
And, residents. And if by chance you bobble or something, we're rolling tape, so it's okay.
Just do it again.
Yeah, we'll do it again. If you want to stop and say, hey, I want to stop and redo that. If you lose your train of thought, that's okay.
Ensures the future of dermatology.
Could you start over again, please?
Sure. Mm-hmm. The Dermatology Foundation ensures the future of our specialty of dermatology.
Okay.
And by that, the way it does that is that it helps fund our future leaders and researchers through donations made by members of the Dermatology Foundation to do what I call critical research in dermatology.
So this really gets to the point where we have this circle that has to remain unbroken.
That is correct.
Can you explain to us what that circle is?
Sure.
A little bit?
We know that in dermatology, it's a wonderful specialty, and we're helping our patients with skin disease. But we're only as good as the knowledge that we have, and that knowledge is derived from research, active research, evidence-based medicine that's going on. And so we need the researchers to feed into the knowledge base of dermatology that then goes to the patient. Well, the researchers have to be funded, and so that's where the whole circle comes back around, in the sense that dermatologists have to be supportive of the researchers so that then they have the knowledge base to treat the patients appropriately and properly.
Okay. Why do you feel that there needs to be a continuation of dermatologic research? Why that's important?
In any specialty, not only in medicine, not only in dermatology, research is the capstone, I think. It is very, very important that we're constantly investigating new causes, new means of therapy for our diseases, because without that, we're not moving forward. In a way, it's kind of like you're canoeing, and if you're not paddling, you don't stand still, you move backwards. And the same thing happens in medicine. If you don't have a foundation of ongoing research, you're not standing still, you're moving backwards. And I think that's what the Dermatology Foundation does.
Okay. Why are you a member of the foundation?
I've been a member since 1992. And the reason I joined initially is because one of my honored mentors asked me to join and said, Elizabeth, it's time. You need to join. And I really was not very familiar with the Dermatology Foundation. It actually originated in 1964. 10 gentlemen had the vision to put it together. But I really wasn't that familiar with it. And when my former professor came to me and said to me, you need to join, that's when I really started looking at what they were doing and what they were doing for dermatology. And it was an easy sell for me. I just said, I'll be glad to.
Why?
Because I am so grateful to the specialty of dermatology for all that it has given to me. I have a wonderful profession. I have wonderful patients. I'm in private practice, and I realized from my residency days the value of the research that was being done in the academic centers. And I knew that everybody was having problems with funding, and this was a way I could give back that was very specific for dermatology. You know, everybody, sometimes when you're making these calls, they'll say, well, I pay my taxes, that goes to the NIH, they fund research. And that's all very true. but only a small drop of that goes to dermatology. Whereas this way, when I make a contribution to the Dermatology Foundation, it's going into derm research. I know where it's going.
So you hold, before you even
and I held the mission of this Dermatology Foundation in high esteem. I was not so familiar with the organization, but the mission of it, I believe, is really the whole foundation for our specialty.
So how do you, I know you kind of stated it, but how do you, tell us again what you feel the mission is, and how, and what is your mission within the mission?
The mission of the Derm Foundation is to secure the future of dermatology. That's what I think its primary mission is. Now, how does it do that? It does that by funding researchers and scientists and physicians to move forward the whole specialty and knowledge base of dermatology, which then translates into better patient care.
And what is your mission within that mission?
My mission, my goal, my ultimate goal is to have every practicing dermatologist join the Dermatology Foundation. I'd like to see 100% of dermatologists join.
Say it again, please.
Oh, okay.
You just stumbled a little bit, and I want to use that. So.
Okay.
Yeah, so what is your mission? Just relax.
Okay. My goal,
okay.
No, I'm fine.
Okay.
My goal is I would like to see 100% of practicing dermatologists join the Leaders Society of the Dermatology Foundation. That's what I would like.
Why?
Because we all share this wonderful specialty that we have. And because I think that if we really can get the message out individually to people what the Dermatology Foundation is doing, they will join me in that so that then we really secure our future.
Okay. So you've pretty much told us why every dermatologist should become a member.
I do, yes. Thank you.
You feel that strongly?
I feel very strongly about it, and I teach the residents as a clinical faculty, and I firmly believe that it's very important to be inculcating that into the residency mindset from day one that they come in. I start talking about Dermatology Foundation, and I start talking about giving back.
Okay. What do you tell the students, just in a nutshell? What do you tell them?
First of all, I tell them they're in very rarefied territory. Many are invited to come interview, but very few are chosen. And for every spot, we have about 300 applicants. So that's an incredible number. So the fact that here they're sitting, I've got 5 people sitting that have gone through the whole interview process. And I'll tell them, okay, now you've made it. Now it's time for you to start growing and to take on responsibility and embrace dermatology as your specialty, and you want it to be better, to grow and be enhanced. And one of the ways you do that is you become a member of the Dermatology Foundation.
So you followed in your mentor's footsteps, and you're showing people the way that you're mentoring now.
I like to think I've been given the baton, and now I'm passing it on to the next generation. Yes.
Why is the Dermatology Foundation successful?
I think it's successful for several reasons. First of all, we've got a committed group that works on our executive committee, and they are untiring in their enthusiasm and their willingness to travel and their willingness to speak with individual physicians as well as the pharmaceutical companies. And it's inspirational, really. They truly believe in what we're doing. It has been that way for me, certainly. They've inspired me. And I think the other reason, and I've lost my train of thought, that was it.
It's okay.
Ask me the question again.
Why do you think the Dermatology Foundation is successful?
And the second reason I think it's successful is because of the excellence and the high standards they have for choosing the awardees, the people who are going to get the grants or the career development awards. A lot of times people say, well, oh, they're just giving it to the people they really like. And that is so incorrect. They have a very rigid, it's an NIH, a National Institute of Health format that they use to pick the awardees. And it's very admirable. I'm not part of that because I'm not qualified to do that. That's not my strong point. But I've watched them go through this process, and it is absolutely amazing. And they put their heart and soul into doing it. And what is so sad is to have 5 outstanding applicants, and we can only fund 4. And so that's another reason I'd like to see more giving on the part of the practicing dermatologists. So we'd fund all 5 instead of just the 4. Mm-hmm. I think it's ensured the specialty of dermatology. It's made sure it's going to stay around for a while. It's done it in 2 major ways. Number one is the ensuring that we have a good research scientific base for our specialty as a whole. We have a pipeline where this new knowledge is going through, be it either for diagnosis or therapy, and it's constantly helping our specialty to evolve and do better. The second way it's done it is that it's made everybody buy into the specialty of dermatology. And by that I mean we've taken ownership of dermatology as a specialty by donating and joining the Derm Foundation. You're becoming part of what dermatology is, could be, and will be by donating to the Derm Foundation.
Okay. What specific, improvements or breakthroughs can you point to that the Dermatology Foundation has had a hand in?
Well, there are many. There are many. And sometimes you read these grant projects and you just say, well, how can this, with all of this chemistry in the name, ever relate to treating a patient with acne? And yet that's exactly what's happened is some of our career development awardees have done very basic research into acne that's now been translated into special lotions and creams and oral medications that we treat acne with. One area that I'm particularly interested in is laser therapy. And I think that there have been some wonderful research-funded projects in dermatologic surgery, particularly in the area of laser surgery. And one of those is our small children with port wine stains that we treat with laser. And these are the red birthmarks, most often on the face, but can be on any part of the body. And we've learned special techniques of using lasers and how to cool the skin, and Dr. Kristen Kelly has been very instrumental in doing research in that particular area. In medical dermatology, they've shown that we used to think psoriasis was a skin disease. Well, our research has now shown that it is a total body autoimmune disease, and it affects the entire body, and that's been because of dermatologic research. I love what I do, and I have some of the most wonderful patients.
And back in 2000, I believe it was, you were named Practitioner of the Year by the foundation.
Yes, I was. That was a great honor that was bestowed on me. And
how did that make you feel? If you can think back 11 years ago or so, what was that when they let you know? What did that mean to you?
It was very humbling for me to get that award because among my colleagues, there are many people who are practitioners of the year in my view. And I was fortunate enough to be chosen to be the one that year. But the person, when I accepted that award, the person I really thanked was actually my patients for allowing me to have the privilege of serving as their dermatologist. Because if I didn't have patients, I wouldn't have a profession.
When you think about the award now, mm-hmm. you reflect back on it and know that was awarded to you some time ago when you're still very active and teaching and being in the clinic, how do you see it any differently now that award?
Only in the sense that I continue to strive to be worthy of that award. And I think that's what's real important. Just as I tell my dermatology residents, even though you finish your residency, your learning is only just beginning. And I kind of view that with that award. That was a wonderful honor I received, but it doesn't mean that now it's all over and I stop. It's just I continue and strive to do better.
Okay. What has impressed you about people who have won? In any particular you can think about, or just sort of the group in general? What has impressed you about these people?
I'm actually in awe of these people. They're bright, they're young, they have an enthusiasm that is contagious, and they have these wonderful imaginations and creative minds, and they want to do it. And they're trying to figure out new ways to cure diseases or why things work a certain way. And, you know, sometimes I think practicing dermatologists get in the everyday, we have a schedule of patients, we have 30 patients to see, we have all this to do, and we get divorced from the laboratory, from the research part. And I look at these people that we're giving the awards to, and it's just very exciting for me to think this is our future. These are the people that are going to make our specialty better. And as a group, I find them, I can't even, just let me think of a word here. I think I find them inspiring, absolutely inspiring.
I bet they feel the same way about you.
Oh.
So, Dermatology Foundation and help them.
Well, I believe in the mission of the Dermatology Foundation very, very intently. But I have to, this is a little story, and y'all will probably cut it all out, but I just got to tell you this. The year that Hurricane Katrina hit Louisiana in 2005, I am very proud of something about my state of Louisiana and the dermatologists in that state. We don't have as many dermatologists in Louisiana as they have in Texas or New York or California. But percentage-wise, we had one of the highest percentage of practicing dermatologists who contributed to the Derm Foundation in the year following Hurricane Katrina. Now, I think that's amazing because here, many of the people in our state lost their homes, they lost their practices, they had an exodus of hundreds of thousands of people from Louisiana, and yet the dermatologists in that state as a group wrote that check to the Leaders Society in greater numbers than they ever had previously. And you have to ask, why did that happen? What was it there? And I personally think that one of the reasons we had such a tremendous response that year in our solicitation in our Leaders Society campaign was that people were grateful for the specialty of dermatology and all it had given to them, and that they still had a practice after the hurricane. And they were saying, thank you. I want to support my specialty. And you know, I look around the country, and I find that amazing that a state that was really devastated came forth that year for the Leaders Society in that manner.
Yeah, I wonder why.
I think it's because they were grateful. Gratitude, and it's funny, sometimes the people who have the least give the most. Often you'll find that in a lot of organizations you work in, and they'll be the most generous. And it was like they were down and out, but they were going to give it.
And who led that charge?
It was led by a group of us in the state.
And mostly you, though, I think.
No.
Okay. Why should residents, you kind of talked about this,
Mm-hmm.
you feel it's important that they get started right away. You So why is it important for residents to jump right in?
I think as the Dermatology Foundation has recognized that it's real important for residents to get involved. From day one, they have what's called a project awareness, where we go and speak to the residents about the Derm Foundation. And the reason that's important is they need to know the value of what we do, the value of our mission, and they need to know that we can't do it without them. We need their support. And okay, we understand right when they get out, they've got a big bill for medical school and they're starting their practice and all. But that's one of the reasons we have reduced dues right after they get out. But after 2 or 3 years, it's time to step up to the plate and start giving and making that part of your annual giving that you do. And if you don't have dermatology, you're not going to be able to give to all the other charities and other organizations and foundations if you can't do your specialty. So that's why I tell them the first thing you want to give to is the Derm Foundation.
Can you give me your sales pitch to, like, what you would say to...
when I'm calling up somebody to join the Leaders Society?
Mm-hmm.
I've become more electronic. My colleagues have convinced me of this, but I still believe in the old phone call method. I like to talk to people, or I really like to see them face to face. What I say is I would like you to join me in the Leaders Society. And in that, right in that sentence there, I'm letting them know I'm already in it. I'm part of it. I have respect for you, and I'm reaching out to you to ask you to join me. And then I tell them what the Leaders Society does, how we fund research for the future of dermatology, and we believe in funding people and their research projects. Oftentimes, it's interesting when you reach out to people one-on-one in that way, and it's always easier if you're reaching out to someone you know. That will often be all it'll take. They'll say, sure, no problem. And sometimes it's a little stumbling block. I have to tell you this, Vinny, and I know we don't have a lot of time, but I just got to tell you. I called one of my former residents, and I said, call him Joe. I say, Joe, I'm calling about the Derm Foundation. Oh, yeah, Dr. McBurney, I love the way you taught me. I'll do anything you want. He said, what you looking for? And I said, well, I'd like $1,500. He says, oh, I was thinking about 100. And I said, oh, no. I said, we need more than that. And, well, he ended up giving 100 that year. But it doesn't matter. And even if they tell me no, it's not something to be taken personally. You must remember that we're planting the seed for possibly a future donation, a future contribution. And you don't ever go away from these things feeling like, oh, I've been turned down, I've been rejected. We just haven't shown them the light yet. That's all it is. And they'll come up again. Mm-hmm. And it's amazing how often people will say, this is the 4th year you called me. Yeah, I'll do it this year. You know, and they'll come around.
So you spend a lot of time interfacing with people.
I do, but I like that. I mean, I enjoy people. That's not a problem.
Right.
That's okay.
Is there anything else you want to add to?
Would you like to make a donation to the dermatology?